I want to talk a little bit about one of the vaccine myths that we have heard, because it's related to, especially in the teacher population, and also to some extent in the nursing population. People who work in those professions do tend to be women of reproductive age. And one of the things that we're hearing a lot is this myth about possible reproductive harm or effects on future ability to conceive. And so I have a little bit of a rant about this. I mean, we've taken a ton of questions about it. We've actually addressed it once on in a post already. And I just want to emphasize that this is a myth. There is not a recommendation that someone who's been recently vaccinated wait 3 months before trying to conceive. That information comes from the phase 3 drug trial participants, and it's actually it's very common. It's almost boilerplate language for a phase 3 drug trial. It is not the recommendation for the general public that there is any reason to wait to try to conceive after you've received the vaccine. And in addition, the reason there's not such a recommendation is that if we look at the way these vaccines work biologically, there's just not a biologically plausible pathway for there to be an effect on someone's future fertility. And this applies to both female and male future fertility. So what does that mean, that there's not a biologically plausible pathway? If I said to you, Ashley, well, we don't know if this vaccine might cause us to grow an extra pinky toe at some point in the future. You might say, well, no, we don't know that, but why on earth would we expect it to? There's just not a reason why. I mean, there's no biologically plausible way that could happen, right? And so I want to be frank about it. This story about there being infertility or possible infertility for either men or women as a result of these mRNA vaccines is a scare tactic. And we've seen it deployed in a very intentional way by the anti-vaccine advocacy groups. And I just want to call it what it is. It's a fabrication meant to play on our emotions. So in a nutshell, if the objection you're hearing is that the mRNA vaccines could have a future impact on either female or male reproduction, there is no reason to think that that is true. That's a myth. It's a fabrication.
Agreed.
So that's my rant on that particular one. I mean, I think it's really important what you said about listening and hearing what the specific concerns are. And I think that people want to make these decisions in a way that's informed, and and I hate to see these very targeted attempts to undermine the vaccine by playing on our emotions.